Live from the EPB Fiber Optic Studio, this is WLND Signal Mountain, Chattanooga.
Health, wellness, lifestyle, nutrition, and so much more. Welcome to Vital Health Radio, presented by CHI Memorial on 98.1 The Lake, a production of Whitfield Media Group, with your hosts, Ed Jones, owner of Nutrition World, and Dr. Christopher Greene, board-certified medical doctor.
Good morning and welcome to Vital Health Radio, presented by CHI Memorial 98.1 The Lake. Thank you for taking your time this Sunday morning to join us. We are a radio show that's all about your health, wellness, lifestyle, nutrition, and healthy living. I am Ed Jones, owner of Nutrition World here in Chattanooga, and joining me normally is Dr. Christopher Greene, board-certified doctor and chief of staff, CHI Memorial, but he is on a much-needed break and will be back next week. So we are back here again. I've got Sean in the studio. Good morning, Sean.
Good morning, Ed. Glad to be here.
And we also have a nice guest that's joining us. Will you introduce her?
Yes, I will. That is Carla King, and Carla, help me out with the name of your business.
Balanced Health and Aesthetics.
Balanced Health and Aesthetics. And she's been here in Chattanooga a couple of years, and we're going to be talking with her momentarily and get into some conversation about hormones and thyroid and all those topics, Ed, that have been talked about occasionally here on the program. And you have also focused on very well on the Holistic Navigator, your podcast. So should be some great conversation.
Well, thank you for that. And the thing is, I tend to live in a kind of a closed box, which is I talk about nutrition and health every day, 6 days a week, and I've been doing it for almost 41 years. So I tend to assume that a lot of this is known information, and I know that Carla certainly understands this. It is not. It is actually, you have to dig for it sometimes, and the normal conventional thinking patterns in this community are not really stepping out of the box very often, and so it is a chore. It's an ongoing challenge and job to educate people to not think conventionally, because the thing is, conventional thinking at times is the most wonderful on earth. If I have a car wreck, if I have a terrible UTI, if I have a pneumonia, heart attack, I want the conventional stuff. But for prevention, for holistic, for non-drug, non-side effect treatments, you have to think on your own and partner with people like you, Carla.
I agree. I think that one of the best things is preventing a problem, preventing chronic illness. I tell people all the time, when I die, I hope it's that a bus hits me or I jump out of a plane and my parachute didn't open. I hope that it's not because I died from chronic disease, because I totally think that's preventable.
I do too. And, a few of us are dealt a really bad hand of cards, but generally we produce it ourselves. And the advice we are getting is not helping that much, because the third leading cause of death in this country is prescription drugs that are written the way they're supposed to be and taken the way they're supposed to be. So if the third leading cause of death is prescription drugs, we better be very leery of getting those little white pieces of paper and keep adding it to it as we age.
Polypharmacy is a big thing. One person's taking something to treat a symptom from another prescription that they're taking, and it just on it goes in a snowball effect. On
and on it goes. You're right. And you know what? People don't enter that area of their life expecting that to happen. What they do, and we've all done this, you're not sleeping well. Well, here's a prescription for the sleeping pill. And, you start with one thing, but then all of a sudden something else, and then something, and before you know it, you're spending a lot of money and you're creating huge havoc on your health, because now you've got 4 prescriptions, none of which does anyone want to take away. And then you're kind of caught under the umbrella of fear, because you know what? If my doctor says that I need it, well, I must, and I don't really know what he knows, so I better believe him. Well, we have to be informed consumers, because they are wonderful people involved in a broken system, in my opinion, and they are so trained on so many areas, but the problem is that it's so focused on pprescription polypharmacy, as you see every day, as I have seen for 41 years. I know this morning, looking at the health news before I came in, it was talking about a study with 42,000 women where sleeping with the lights on at night generally resulted in a additional weight gain of 10 pounds. And I assume, Carla, and you've given me your feedback, one is cortisol levels. Cortisol is the hormone that you secrete when you are under stress. Americans are probably under more stress than probably any country of the world because we push ourselves so much, and we drink drinks that push it, and we eat improperly, blank, blank, blank. So the higher cortisol is like prednisone, and when you see anyone with prednisone, guess what happens? They gain weight, puff up. And when you produce your own, it's not that dissimilar. So if you sleep with lights on, you are doing something that I refer to as you're countering ancient wisdom. Because if you look at every animal on Earth and every human until we had electricity, we went to sleep when the sun went down. We got up when it came up. We are a species hooked into rhythms of nature. Well, guess what? We've unhooked that rhythm, and there's a price to pay, and this is one of them. So that was a surprising study, actually, to me.
Well, it really doesn't come as a surprise to me, Ed, because there's a lot of things that show us that when we're in a deep sleep, when we sleep deeply, that we also that's when we're gonna secrete more human growth hormone, and human growth hormone is what helps us keep leaner bodies and have less visceral fat. So I can believe that it makes sense to me that when women have the light on. I know for myself personally, it has to be totally dark for me to really sleep well. There's just if there's a light coming even through the crack in the door, I don't like that. I like it to be totally dark, and I don't know how I came to that other than probably I just realized I was getting deeper, better sleep.
So Ed, that 10 pounds, is that over a year or over a lifetime?
No, it's over a number of years when they compared women that were like 40 and above. But health is cumulative, and the thing is, these kind of things we do is going to pay a price with time, and that time is cumulative. And when you're 20 and 30, you don't sense it because the change is too small. It's generally when you hit 40 plus. And I did do I rarely talk about or brag in any way about the Holistic Navigator, but the one on sleep that I did, I talk all about these exact issues. And I do use a mask at night. I don't know about you, Carla.
I don't, but that sounds like a good idea.
But I have to have darkness because I don't get to the level of deep sleep that I need. But the other thing that I do, which I've talked about many times on here because Dr. Greene was so intrigued at first and we joked about it, is I do believe in a physician named Dr. Buteyko. Dr. Buteyko was a Russian physician who taught breathing, and he said many things about it, which is my latest podcast on the Holistic Navigator. We are all breathing wrong, and breathing wrong means you are breathing through your mouth instead of your nose. And Dr. Buteyko said in 1950, he said you should breathe through your mouth as often as you eat through your nose, and we don't eat through our nose. But the thing I do every night that's made the most significant difference of any one single thing is taping my mouth shut at night.
Wow.
I use NextCare tape, and I've been doing it for 4.5 years. It will allow people to, number one, you never wake up with a dry mouth. You preserve your teeth better, but you get into a deeper sleep because we all have periods when you mouth breathe. You can be slightly sleep apnea.
Yes.
And what happens with that is you halfway wake up during the night. Well, guess what stops that? A $4 roll of tape that lasts you 4 months. We sell it at Nutrition World, and it is unbelievable.
And speaking of prevention, something else that you really are doing is when you mouth breathe and you have those periods of sleep apnea, you really are becoming chronically hypoxic over time. And that's one of the biggest risk factors for heart attacks in this country.
Oh, I love it.
We don't talk enough about that. And heart disease, yet, is a leading cause of death for both men and women, and we don't talk about all the things that can prevent it, like getting some oxygen.
Isn't that the truth? And I actually just came back from a trip and down in Florida. I don't get away enough. I know that's not healthy for me. There are certain things I know that I do wrong, and I admit it, one of which is I work too hard, and I'm trying to do better at that. But I'm saying that to say every year I go to Florida, I test myself because I'm not one to, I'm a lot better at sometimes giving advice and taking it about certain things like blood work and other.
Oh, not me. I don't do that.
No, I know you don't. You're perfect. I am a hypochondriac, admitted, and I am scared to death of finding out lots of things. So I do everything right 90%. But where I test myself is in the gym and on doing things. So every year I've ever gone to Florida for my whole life, is I do this. I get in the swimming pool and I put my head down and I test how long can I hold my breath. And I always it takes me 3 days to get back to where I want to be. So the other day I did it. On the third day, I did hit 2 minutes and 59 seconds.
Wow.
So as long as I can hit 3 minutes right there, I'm still hanging in. I'm hanging in. But, that's something we need to work on is breath holding. In fact, I do push-ups holding my breath based on a guy named Wim Hof. Have you ever heard of Wim Hof?
I've not heard of him.
He's a Polish gentleman who actually has taken people who are basically untrained and in 8 weeks will have them climb Mount Kilimanjaro in equal or better times than people who have trained for years. He does this through breath holding. And he is an incredible individual who is truly like something from another planet. WIMHOF for anyone who wants to look it up. Please YouTube him. He's got some videos that are beyond belief, but his principles are about health also, not just endurance. And I'm a big follower of Wim Hof.
I wanted to go back to one thing you said a few minutes ago when you were talking about that study with women and about the cortisol levels. One of the things that I think that people in this country don't recognize enough is that when they do read a study, they'll look at one result of the study, and they'll just assume that that's a causation. And I think it's important for us to stress to people that sometimes it's not a causation, it's just an association. And I think that the reason that study in women around 40 and up that we see it is because around 40, women are also beginning to have a decline in all hormone production, especially progesterone. It kind of takes a nosedive, and that's the hormone for women that helps them to sleep well.
Boy, isn't that the truth? And we're not machines, we're not cars, we're not single entities that you replace one part. And as you know, you've seen it. I know all too well from your speaking of this. You take the step back and you look at the big picture. That's the only way this human body's going to age gracefully and do well. Well, it's already time for us to take a break, guys and girls. And when we come back, I've got such an interesting guest, a friend of mine, Dr. Scott Resnick. And we will be talking about, again, women's issues with him. Awesome. So we've got that plus more to come. For Ed Jones, Carla, and Sean, I'm Ed Jones, and stay with us.
You're listening to Vital Health Radio, presented by CHI Memorial on 98.1 The Lake. We'll be back after these messages. Welcome back to Vital Health Radio, presented by CHI Memorial on 98.1 The Lake.
Welcome back, and thank you for making us a part of your day. If you're always on the move, download the free radio.com app to your smartphone or tablet and keep us tuned in each Sunday morning right here on 98.1 The Lake. We are a radio show that's all about your health, wellness, lifestyle, nutrition, and healthy living. I'm Ed Jones, normally here with Dr. Greene, who's on vacation, but today we have a friend of mine, Dr. Scott Resnick, who has known him for 6 years now, and he's just a wonderful, highly trained physician that has moved here years ago, and sorry to say he is moving away soon, and we'll be losing him. But welcome to Vital Health Radio, Dr. Resnick.
Thanks, Ed. As always, it's nice to be with you. We seem to be able to sit down and talk about any number of different topics. So I guess today we are talking about women's health. Is that right?
Yep, that's what I would love to talk about. Now, the thing is with you, Dr. Resnick, is you do fall under the classification of one of my most favorite terms, which is functional medicine. And what is that? To me, functional medicine is actually far different than conventional. It's where healthcare professional like yourself would actually dig deeper, look further as to the real true underlying reasons why we have health issues and declining health, and fix it from that angle rather than treating symptoms. But I know you've been practicing that now for a number of years. I've always been impressed with your philosophy and your take on how you are help so many patients. But as far as hormones, women, the fluctuations, I hear every story because I work 6 days a week, and people do feel comfortable sharing a lot with me. And a lot of the standard cookie cutter ways that women are being treated is probably not ideal. Is that your take?
I would tend to agree with that. I think that one of the venues of the most misinformation and mistreatment that I see professionally comes into the understanding and the application of hormone therapies.
Absolutely.
Now, so let's just use a woman for an example. You know, a middle-aged woman. She's having some issues. Everything from maybe sleep to mood changes to could be weight gain, other things. What would you do that would be different? How would your perspective vary from, say, if they go to their normal, regular physician? What would be different about that?
Well, I think there's so many different questions that we can ask that really give us some opportunities to really take these patients and give them some new opportunities and really some new hope in terms of feeling better. You mentioned a couple of different things. I mean, certainly you mentioned weight gain, and as we were talking about before the show, I think one of the causes of weight gain is as women get into a state of estrogen dominance. So, basically what we're talking about is a fraction, right? So you've got a numerator and a denominator. So if you're talking about an estrogen, say, progesterone relationship, your estrogen can go up or your progesterone can go down. So what's interesting is that when you start to look at things in our society that might contribute to these different factors, we need to really address it from looking at that fraction. So the first thing which is really challenging about managing a woman's hormone levels is the fact that for a woman who's in the premenopausal years, they change. I mean,
no man's land.
They change over the course of the month, and as opposed to generally the trend that we see in men's hormone is the downtrending of our testosterone as we age. Sort of in the premenopausal years, a woman can have changes in these estrogen and progesterone relationships. So I think that's the first important thing to recognize. And I can tell you that as a gynecologist, one of the things which is most challenging for me is when I have a patient who's been in to see often another gynecologist who has just checked hormone levels whenever. And it's not uncommon that I will sit with the patient and look at her labs that she's brought to my office. And the first thing I'll say is, when were these hormone levels drawn relative to your cycle?
Right.
And the answer across the board is,
I don't know.
I don't know. Well, if the patient doesn't know, it's likely that the doctor didn't know. So right off the bat, I think that's one thing that we need to recognize
So
is
important.
that there's a natural alteration of these hormones through the course of the month. And the easy thing to remember is that estrogen has a couple peaks over the course of the month, and effectively progesterone is almost unable to be measured in the first 2 weeks of the month. It rises up in the last 2 weeks of a typical, say, 28-day cycle, and then it drops down. And then it's this dropping of progesterone that is known to trigger the menstrual cycle.
Right.
And so conventional methods are to give the normal cookie cutter progesterone at night, right?
Well, I think it depends on different ages. I think the easy kick the can down the street is to put a woman on birth control pills.
Well, yes, I think that's conditional, but that those are progestins most of the time, which a lot of people don't understand is different from progesterone.
And that's a really essential, a critical distinction that you've made, which is the fact that even in today's literature, I see papers that are done in the scientific literature where the compound studied is something called ethinyl estradiol. Ethinyl estradiol is not estrogen. Progestogens or progestins are not progesterone. So when we talk about a bioidentical hormone, this is an absolute 100% three-dimensional electrical chemical copy of what your body makes. Well, there are a number of compounds out there that are not exact three-dimensional electrochemical compounds, but they have effects on our body.
I like to use the example Premarin to women. I say Premarin does contain estradiol, but it also contains about 15 types of estrogens. Premarin, pregnant mare urine.
Right.
I said, it comes from horses, and it's, horses are 2,000-pound animals. They're not, human women, and so it's not bioidentical, meaning it's not molecularly the same as what your body produces.
Well, it's bioidentical if you're a horse.
Right, exactly.
Bingo. I love it. I love it. So if you felt uncomfortable or didn't want the woman to take the synthetic progestins, then you would be doing what?
Well, I think what I would, like with any good medicine, I think the first thing you need to do is get a good history, do a good physical examination, because it might be that your patient comes in complaining of abnormal or heavy bleeding, for example. If you do an examination and she's got a uterus that's the size of a grapefruit, that I don't feel that hormones are going to be the appropriate treatment if she's got a massive fibroid, which is contributing to it. I mean, I think you can do a good history and physical examination just to get started.
I think that so many times our doctors don't spend enough time with history. Whenever people come to see me in consultation, I tell them that first visit they need to plan on at least 2 to 2.5 hours.
Right.
Because that's how long it's going to take for me to hear your whole history of what's going on with you and your symptoms.
Right. And I saw you shake your head just a little bit when I said a massive uterus. I'm saying if someone's got so what I do is really look at abnormal bleeding, for example, in one of two classes or a combination of both. I mean, there are anatomic causes. I mean, your anatomic cause could be a cervical cancer, which is contributing to the bleeding. If no one looks and does a pap smear, you won't figure that out. But I really think what we're focusing on now is really kind of the hormonal causes and some of how as a woman ages, or there are other factors such as stressors, dietary changes, weight, emotional state, thyroid function. All these things collectively contribute to ultimately a woman's menstrual patterns.
When you were saying a minute ago that, you really need to know where in the cycle someone was, when they have these labs drawn, I tell people all the time, estrogen fluctuates throughout the cycle, and it fluctuates daily too. It's
Correct.
kind of up and down. And so when you were talking about diet changes, sometimes, because we store hormones in our fat, a lot of times when women are, actually losing weight, which is a good thing, but sometimes they're releasing stored estrogen, they'll have fluctuations and they'll have some spotting and bleeding and breakthrough bleeding that will kind of get them started. Now, I always tell them first, if they're taking progesterone, I say increase your progesterone, see if you can get it to stop. And then, once it stops, you can try to, bring it back down. But I tell them, just like your body fluctuates all the time, you're going to kind of I give them some leeway with hormones because, it may be that during the cycle, if they still have ovaries that are functioning, they maybe only need one progesterone capsule, but sometimes they may need two.
Right.
So,
and I like to look at estrogen and progesterone as having a relationship of kind of a yin and a yang. So estrogen is what is known as a trophic hormone. It means it makes things grow. I mean, so think of a young girl going through puberty. I mean, her hips begin to grow, her breast tissue begins to grow, the lining of her uterus begins to grow. So progesterone is kind of the molecular. It keeps things into check.
Yeah, anti-proliferate.
It's anti-proliferative, right? To use a long word. So, oftentimes one of the questions we can ask by good history and physical is, what is the relationship of this proliferation versus anti-proliferation? I guess, and that comes back to where we started, which was what is your fraction, and how do those two hormones relate to each other over the course of the month?
Now, do you find that in some women you can manage them from a perspective of non-drugs, and really when you look at the lifestyle, you improve their sleep or this or that they certainly get better without the use of synthetics?
I think that kind of lends itself to an interesting perspective on at least the way that I approach women's health, and that is that I mean, I think it's easy to say, well, if a woman's having problems with abnormal bleeding, that it's all coming from the uterus. But when you start to step back a little bit, you realize, or one begins to realize, that there could be a lot of other factors that could be at play. There could be significant weight changes, for example. There could be emotional factors that are contributing to abnormalities in the competency or the adequacy of an ovulatory state. There could be exposure to different toxins, and I'm sure that we could have a long discussion about some of these, xenoestrogens. These are the multiple estrogen-like compounds that are present in our society in the form of herbicides and pesticides that while not estrogen, have estrogen-like effects on the body.
We're talking about female hormones, but at the same time, I think that a lot of people don't realize that insulin resistance exerts an effect on women's hormones. And I don't really understand why it is, but I just know that when people tend to have higher levels of insulin, they tend to always have lower levels of things like progesterone. We see them have more estrogen and things like that.
And I think that's pretty well established. I mean, I think we know as women get heavier, as they develop more insulin resistance, we start to see more of a syndrome that's called polycystic ovarian syndrome. And I like to emphasize with my patients that I don't think that PCOS, it's not a disease. I believe that it's a transient state that for whatever adaptive or reasons that are over time that our body has reacted to these changes, what we see is we see higher levels of estrogen. Mm-hmm. We see that a woman doesn't ovulate as well, so then her progesterone, which we recall is meant to keep things in check, is lower. And for the reason that I don't think anyone understands is that testosterone starts to go up as well. So we as medical professionals, we can kind of see someone who walks in the door, and you can kind of get a good sense of what her hormone patterns might be by just looking at her.
I know that people call it PCOS, but I like to tell people I actually think that can be a misleading name because it makes us think that there always has to be like cysts on the ovaries. And I tell them that really we should be calling it insulin resistance because you're insulin resistant if you have this. And the ovaries are just innocent bystanders if they get these cysts in them.
Right, exactly. So in terms of how do we address this, well, something like using a progesterone might temporize the problem. But to really fix it, we would need to go back and say, all right, what's driving this? It's insulin resistance. Well, I mean, I'm sure the three of us could talk for an hour about what are the different things.
Well, the issue is that conventional people can't talk very long about it because they're simply not trained in that whole arena. I mean, it is frustrating. I know, Dr. Resnick, that you are made a lot of people sad because you are moving to Portland, Oregon soon.
That's correct.
And I know if you don't mind me putting the plug in, Meredith Mason at briomedicine.com is going to be seeing a good number of your patients because she is a functional medicine practitioner.
That's correct. She'll be the custodian of my charts.
No.
And we've notified all my patients that I feel that she's a very well-trained, compassionate, competent, and I think she'll be a nice person to sort of pass the torch in terms of the functional medicine that I've been practicing over the last several years.
Well, thank you for all of that. And also, you and I are going to be doing a podcast on the Holistic Navigator this next week. So I want everyone to stay tuned because it will be about a 40-minute, very in-depth conversation about women's health again. And I look very forward to that because you and I will be in contact for the rest of our life, I do believe, but not in a close proximity. It'll be more on technology. We've partnered to a point where, I think you and I really can make more value of each other when we're partnering, and it doesn't matter. Miles don't matter that much anymore because I know you're writing a book that, and we will probably write many books in your future, and I look so forward to helping you in any way I can on that. And tell people how to stay in tune and in touch with you as the time goes on.
Well, right. First of all, thank you, and I want to say, Ed, that I have appreciated our face-to-face relationship for all the years that we've known each other, and I look forward to many more years of being able to work together and to help to educate. I think that's the most important thing that we can do is to get people more well educated. And I mean, I'm a medical doctor. I mean, but I have to say that we are subject to the American Medical Association, to the state and local boards, the FDA, and unfortunately, I don't think that this is necessarily the best information for our friends and our family and our patients.
I totally agree. I was just going to say, what a loss to this community that you're going to be leaving because we don't find that many medical doctors that have this kind of knowledge about, the importance of hormone optimization for preventing, chronic illness.
What's going to be your website?
It's scottresnickmd.com, and I've been working on that. And what I'm really hoping to do is to have a little bit of time to spend more time to create a format and a foundation by which I can educate more people. So.
Absolutely. You kind of give me a little bit of a tiny sneak into that, and I am so freaking excited because we're not going to have you here in Chattanooga. You're going to now be everywhere in the whole world, United States mainly. But it's already time for us to take a break, and thank you, Dr. Resnick, so much. When we come back, we're going to be talking more about holistic nutrition health, that with Ed Jones and Carla and Sean, and we will be back.
We're all about healthy living and enjoying life. Vital Health Radio, presented by CHI Memorial on 98.1 The Lake. We'll be back after these messages. Welcome back to Vital Health Radio, presented by CHI Memorial on 98.1 The Lake.
Welcome back, and thank you for making us a part of your day. We are a radio show that's all about your health, wellness, lifestyle, nutrition, and healthy living. I'm Ed Jones, along with my normal partner, Dr. Christopher Greene, who's on vacation. Today we're talking with Carla and Sean, and just had a wonderful interview. I know you enjoyed it, Carla, with Dr. Resnick,
So much,
a
yes.
functional medicine physician who we're sadly to say is leaving, going to Portland, Oregon. He is under the heading of what I call functional medicine, which is more healing type of practice. And we were talking about progesterone, and it is an interesting whole concept because I know a lot of American women are many things, one of which they can be estrogen dominant. And a lot of that, when that does happen, and part of it's environmental because we're dealing in a society where we use so many phytoestrogens, which are fake plastics and perfumes even, and you microwave with a saran wrap somewhere or a plastic dish, you are getting these xenoestrogens. And so the end result is that you have hormone disruptions, you have less progesterone. And tell the listeners the function of progesterone and how it really and truly, a lot of women's fear, some women who have fear all hormones are like, they fear progesterone as much as estrogen, when in fact progesterone can be protective. Isn't that true?
It's very true. Natural progesterone, and a lot of people get this confused because they hear about progestins, and progestins are not the same thing as natural progesterone. So natural progesterone is important in the protection against breast cancer, and oftentimes our conventional doctors think that, if your own hormones and they give you estrogen, they say, oh, well, if you have a uterus, we've got to give you progesterone. That way you won't bleed, and it keeps, the lining from building up. But once if you have a hysterectomy, a lot of times those same doctors are not then giving the females progesterone, and so they're just replacing their estrogen. Well, then you're going to have this thing that's out of balance. And when taking progesterone, it's a natural diuretic. So a lot of times women say, oh, I don't want to be on hormones that causes weight gain. I say, the hormone itself contains no calories. It can't cause weight gain, but you can have a hormone imbalance where you retain fluid because you don't have any progesterone now. So having the right balance between estradiol and progesterone causes you not to retain fluid, helps you to sleep well at night, and most of all, it protects against breast cancer. So, a lot of people hang their hats on the WHI study back done in 2000. So first of all, it's a 20-year study. It's almost obsolete. But in that study, they stopped it because there were 3 arms to the study. One arm was Premarin, which, is a synthetic form, contains lots of different estrogens. And then there was a Premarin and Provera. And Provera is medroxyprogesterone, which is not the same thing as progesterone. And that's the arm of the study that showed an increase in breast cancer, and they stopped the study because of that. But everybody just kind of extrapolates and says, well, all hormones cause breast cancer, and that's not true. So it's important to actually understand these studies that we have out there and to get the most recent literature. There are several studies that actually show that you're going to have less of a risk of breast cancer when you replace your hormones, because when you're replacing your hormones, that's going to decrease insulin resistance because hormones help process carbohydrates. And when we don't have them, we have to secrete more insulin. And those things are inflammatory and lead to things like breast cancer and all forms of cancer, in fact.
And of course, I'm right there with you on all that exact logic. The thing is, I think listeners still may be wondering, they're not really clear. Progestins, progesterone,
Right.
progesterone cream. What is the real story on that?
So, creams, troches, orals, they're all just different delivery systems. And I'll be honest with you, I use a combination with patients. I might use pellets, I might use creams, I might use orals. It depends on what I'm trying to treat. When it comes to progesterone, I'll have to say that anything is better than nothing. So if you were taking something that was a cream, I'm not going to tell you to stop that. When I actually prescribe it, I'm probably going to prescribe you oral, because oral, you're taking it in and it has what's called the first pass effect to the liver that actually benefits you and helps promote sleep at night.
Now, is this the normal conventional progesterone that most women are taking?
Well, so kind of, I want to sort of identify the difference between conventional. So progesterone is, molecularly the same, then it's a bioidentical. And there is one brand that you could get. Let's say your doctor wrote for you to go pick it up at Walgreens. It would be called Prometrium. And Prometrium is the brand of progesterone that is the natural hormone that your body would molecularly produce. You're not getting anything else that's going to be bad for you. If he wrote for Provera, that is not the same thing. I actually had a doctor just recently try to write that for me, medroxyprogesterone. I said, no, I will not take that. only progesterone. So you can get generic progesterone, or you can get Prometrium, which is the brand. What you have to be, or you could get it compounded. You could go to designer drugs, for instance. You could go, somewhere and have natural progesterone compounded, and then you can get it in different milligrams. Commercially, you can only get it in a 100 milligram capsule or a 200 milligram capsule. And just like we were hearing Dr. Resnick say, your hormones fluctuate throughout the month. And so I tell people it's really best to get your prescriptions where it says take 1 or 2, and I'm going to kind of let you have some leeway, because you know how your body feels, and part of the month you may need to take more, and part of the month you need to take less, just depending on how your natural ebb and flow is of your hormones.
So the one you're mentioning that you recommend, the other one you're not recommending because of?
Well, because of the increase in we see in breast cancer, and because
that's the one that was seen in that other study.
That's right. It was seen in the WHI study as medroxyprogesterone. It was not progesterone.
Got you.
So it can be very confusing, and you have to really understand that.
Would most physicians, if you requested that, write that particular one?
Many would. It's amazing how many people are still taking Provera, which is another name for medroxyprogesterone. It's probably the only time that I would ever advocate that somebody take that is if they were having extremely heavy bleeding, and they were going to only be taking it for just a short period of time until they could do something else to stop that. We could find out what it was, because it is known to stop bleeding, but it's not something that is natural, and it has a lot of side effects that we've seen in other studies that are not going to be good.
How interesting. And I love the fact that you did say something earlier, and I don't recall if it was on the radio or not, about Father Time, once our hormones are really low, really wants to dispose of us.
Oh, yeah. I tell people all the time, that's how Mother Nature gets rid of us. If you look at animals in nature, they're born, they grow, and their hormone levels increase, and they get to a place where they're at their peak, and they're going to procreate. And they, have their babies, and then once they've procreated, their hormone levels begin to decline, and that's when they become sicker and weaker and more susceptible to either disease or prey, and they're gotten rid of. And in our society, the same thing happens to us. We're at our peak when we're in our 20s, and then maybe by mid-30s to 40s, all people across the board, and we don't talk about it enough in men. We're talking about women's health today, but men need to realize that their hormone levels are declining too. And by age 40, we're all seeing a decline. And as you have that, insidiously, all these different things start to happen. And people think it's just, well, I'm getting older, I don't sleep as good, and I have a little ache and pain in the morning, or I'm starting to see cholesterol changes. I tell people, we don't see cholesterol changes in young people, and they eat some of the worst diets ever. They have pizza and French fries and whatever. They don't have high cholesterol. So it couldn't be just your diet. There has to be a direct correlation to what we see that's missing when you get older. And that's what it is, hormones.
Well, and I think you would not disagree with me, that and the changing insulin levels, because that is this killer. That's the killer on all levels.
Well, that kind of goes along with hormones. So hormones, what we don't understand is that they actually help us to process carbohydrates. And so as you begin to lose hormone levels, both testosterone in men, that's why men, as they get a little older and they've lost testosterone, they get a little spare tire in their stomach, because now they don't have as much testosterone to process carbohydrates. So they start to dump more insulin, which is a bad hormone. So I tell people, hormone optimization is really a practice of keeping good hormones higher and bad hormones low. And insulin is a bad hormone.
It is, and there's so many reasons why it elevates, and I've spoke on this for decades. Too much stress. Cortisol is the cousin to insulin, and when you have really high cortisol, it drags your insulin up. So when you're not sleeping, you're going to have higher insulin. When you eat too many carbs, it's stressing the system. When you don't take enough omega-3s, omega-3s are tremendously important.
Yes.
And people who say, I take a fish oil pill, when I look at their omega-3 levels, when they do get it checked in blood, it's just dismal unless they do the right dose and do it correctly. And I love the fact that Dr. Resnick earlier said, it's almost a joke when a woman gets her hormones tested one time. The physician doesn't even know what part of the cycle she's in. She doesn't remember it. And I say this constantly. We could do 30 hormone tests if I was talking to a female in the next 30 days, and they're all going to be different.
Exactly right.
So how in the heck do you expect to get this one test and the doc says, you're fine. You're fine. Right. Well, maybe if you were fine that day, you're not fine maybe the next week.
Well, I tell people all the time, you need to go to someone who, looks not only at hormone levels, that's just kind of a guide for therapy, but listens to your symptoms. Because
Yes.
if you look at the symptoms, we're treating symptoms, and certain symptoms are going to scream, you've got a hormone imbalance.
Yeah, and the thing is, I know that big study long ago really sent shockwaves throughout the whole
Yes.
United States for fear of hormones. Now it's come back around again. They're kind of okay if you do it the right way, but we've learned so much since that study was done how to make it healthy. But
Yes.
you've got to find the right practitioners who understand it. I know that you'll mention it probably in the next section, but if someone wanted to get in contact with you, how would they do that?
Well, if someone wanted to see me for, to have their hormones looked at, they could just call me. I have a concierge practice. I really try to keep my practice very, very small because I spend a lot of time with patients. My initial consultation, I do a lot of blood work, and then I spend about 2.5 hours going over all that, and I look at all of their history, their patterns in their eating, their sleeping, what stressors they have. I want to sort of look all the way back and see what, their family history is. I look at some genetic markers in my blood work for what what we're trying to prevent. So I take very few people, but they could reach me just by calling my a cell number and just leaving a message, and I get back in touch with them. And that number is 615-308-1253. However, I'm more passionate about educating people. I want people to educate, practitioners, all practitioners,
Bingo.
Doctors and nurse practitioners alike about the importance of hormone replacement and the safety of it, the necessity of it.
There you go. We'll repeat that number one more time for people who grabbed a pen and couldn't write it down.
615-308-1253.
Wonderful.
I want to add one more comment, Ed. It's a little over a year ago. Carla went through my blood work, and when she says that she spends 2 to 2.5 hours, I didn't really take that to heart until I experienced that with her, and my head was swimming in total mush after I spent that time with her. And another thing that I couldn't believe is she was telling me things about myself and about my family history that I had not shared with her. And it was almost like she was had been following my life around in my family history with video and had evidence before I even shared any of it with her.
Yeah, I remember one thing was I told him, I said, somebody in your family has diabetes. And he said, no, they don't. No, they don't. And I said, somebody in your family has diabetes. And later I was introduced to his mom a while back, and something came up, and like 2 or 3 people, aunts owned that he didn't ever know had diabetes. And I said, I said, I told you.
Like a fortune teller, a trained fortune teller. All right. Well, it's time for us to take another break, and when we come back, we will be doing our 4th segment between the 3 of us, which is really fun. I've enjoyed this. So for Ed Jones and Carla and Sean, stay with us.
You're listening to Vital Health Radio, presented by CHI Memorial on 98.1 The Lake. We'll be back after these messages. Welcome back to Vital Health Radio, presented by CHI Memorial on 98.1 The Lake.
Welcome back, and thank you for making us a part of your day. If you're always on the move, download the free radio.com app to your smartphone or tablet and keep us tuned in each Sunday morning right here on 98.1 The Lake. We are a radio show that's all about your health, wellness, lifestyle, nutrition, and healthy living. I'm Ed Jones, back again today with Carla and with Sean. We're talking about all kind of things, mainly focusing on women's health. It was so helpful today with so much information. I know, one of the most common questions I ever get asked is about sleep.
Yes.
There is no doubt. And I know that I would say no less than 3 to 4 times a week, people are coming in who are prescribed Ambien. And they're stuck because what the problem is, they've already kind of wired their brain. That means when they don't take it, they simply cannot sleep, no matter how hard they try. And of course, trying to sleep is destructive to sleep because it doesn't work that way. And secondly, is you start losing some of your memory as far as amnesia. And what I basically, and I do have on the Holistic Navigator, I feel like a really informative podcast on how to sleep better. I am a chronic insomniac myself, so that is something personal to my life, and I manage it pretty well. And we have to always remember that, we're always going to have we have a human body. It's not perfect, and as we get older, part of journeying into getting older is managing. Doesn't mean you have to fix everything, but if you can manage it, you can do quite well. Well, I manage my insomnia through the use of multiple things, but the thing is, and I'm not, as anyone knows, a big fan of drugs, but Lunesta is a far cleaner sleeping pill. And I tell people to wean off of Ambien, you need to get Lunesta. And Lunesta will not give you the memory loss. It is so much more expensive because the patent life hasn't ran out on it. It will not knock you out. What it does is over a period of 1 week, it starts working pretty dang well, but it's not addictive and there's no memory loss. Then when you're on a Lunesta, then you wait about 6 weeks and then you start half dosing while you're using other things like taping your mouth shut at night, like I speak on the Holistic Navigator. And when you wake up, you always have next to your bed GABA, G-A-B-A, and you take 1,000 to 1,500 milligrams upon awakening. And GABA will not work at bedtime. It only lasts 3 hours, and it will recalm the brain back down. The reason most of us can't go back to sleep is because the brain has what we call cognitive popcorn, and it's popping like crazy. So my 2 recommendations is get Lunesta, one, and then secondly, have GABA next to your bed. If you get up, go to the kitchen, turn lights on, and get water, you're done. So you have to have it handy somewhere very, very close. And don't follow the bottle's directions. Legally, you have to say check with your doctor or healthcare practitioner. But if you do 500 milligrams, it generally doesn't work. You need 1,000 to 1,500.
That's good to know because a lot of times it comes in like 500
It all
milligram
does.
capsules. Yeah.
And there's many nights that I will do a 12 o'clock dose and a 3 o'clock because there's nothing worse than waking up at the 3 o'clock hour and then you barely get back to sleep till your alarm goes off, and then you drag because you don't get that last 2.5 hours.
Just to stress, Lunesta is a prescription drug, so people do have to get that through their doctor.
Exactly. Good.
And then the GABA, they could get it at Nutrition World. That's a supplement.
Absolutely. And I travel. I just came back from a trip to Florida, and I would never travel without my GABA. And I mean, GABA is wonderful during the day.
It does. It helps with anxiety.
Yes, because our GABA is a natural component of brain chemistry. If we have tons of GABA, we are much calmer. When we tend to diminish GABA, we get more frazzled.
Well, just to bring up the whole issue with sleep, I want people to know that, I get people telling me all the time, well, I'll say, do you have any sleep disruption or any insomnia? They'll say, well, no, I don't. And I'll say, so you don't wake up at all at night? And they'll say, well, I wake up, but I mean, my dog wakes me up. And I say, or they say, or I wake up just to go to the bathroom. And I say, if you're waking up, you have sleep disruption. Kids don't wake up. The dog doesn't wake the kids up to go to the bathroom. Kids don't wake up to go to the bathroom. So we need to think back to how we were when we were like teenagers. That's when we were at our optimal health. We were in our 20s and teens. And if you are sleeping through the night, then I would consider that you probably likely have optimal hormone levels, unless you're taking something to make you sleep through the night. But otherwise, if you're waking up, even if it's just once, you need to think to yourself, could I possibly be having a decline in my hormone levels, and maybe get that seen about, because you don't want to wait till you have none before you start to replace them. Progesterone is one of the most important things for females in sleeping well at night, and that's why women in their quote late 40s or early 40s and late 30s, start waking up and they say, well, my kids wake me up. I'm a light sleeper because of the babies and things. It's because they're beginning to see a decline in progesterone. It falls off first, way before estrogen.
Love that. And, there is an herb that I really, really have great respect for in the early stages. I don't know if you're a big believer in it, but Vitex or chaseberry helps the female body make more adequate levels of its own progesterone. And very good clinical studies, PubMed and others have some good studies on this. Now, if you're full blown and you're terrible, your progesterone is extremely low, it's not going to do the trick. If you're in that middle range where, again, you're late 30s, early 40s, 30s, perhaps even late 40s, and you don't want to go fully in the route of adding hormones yet, you can do Vitex or Chaseberry, and two of those of a good quality nature will, and I've seen it on blood work, will help the body produce more of its own hormones while it still can do that.
That's great. Another supplement, but it's not actually a drug yet, but it's a hormone, and that's DHEA. And DHEA is a precursor to the production of progesterone, so it will convert into progesterone and testosterone both. So those are both things, testosterone levels being adequate is what helps men to sleep well through the night, and progesterone for females. So getting a supplement of DHEA would be great as well.
I did not even think of that, but it's something I do every day because I do 25 to 35 milligrams in the morning. I will say DHEA excessive amounts in women is not real pleasant because they can grow a mustache and get oily skin and acne.
Well, you can always counter that. We talked earlier kind of off the radio about the few drugs that you kind of think are okay. And I have about 5 actual drugs that I will prescribe one time. And one of them is called spironolactone. I tell people it's a wonder drug. It's really supposed to be a blood pressure medicine, and it has a kind of a diuretic effect. But the way it works is it blocks the androgenic effect at the level of the hair follicle. So you can keep your DHEA levels high, but have no hair growth and have no acne formation. And also it keeps men, this is one of the big secrets that people don't know about, and I actually recently asked a cosmetic surgeon why he didn't prescribe spironolactone to men for hair loss rather than Propecia, those things like that, because they have so many bad side effects. And it blocks the androgenic effect of testosterone converting to DHT, which causes hair loss in men and in women.
But it's not going to lower the testosterone in it?
No. It only works at the level of the hair follicle to block that androgenic effect, so it has no effect on the actual hormone itself. You would die if I told you what my DHEA levels are, but studies show that DHEA, the more you have, pretty much the longer you live with, the less disease. It's a very preventative hormone. It helps us deal with stress and illness. And when we have low levels, we need to be thinking about adrenal fatigue. And so I personally keep my hormone level of DHEA way above normal.
So how much do you take of DHEA?
Personally?
Yeah.
I take 100 milligrams of a slow-release DHEA, and my DHEA level is kind of off the charts. But I have been through tremendous stress over the last 4 years. I've had lost my father, my husband, and my child in the last 4 years, and I feel like that had it not been for hormone optimization, I would probably be curled up in a ball somewhere under, a table or a bed.
Bless your heart, and thank you for sharing something of that intimate nature, because the thing is, life is going to be rough at times,
right.
And that's not fair to have that much going on in anyone's life. But the thing is, how many people would have journeyed through it the way you did? You supported your body. You didn't massively medicate just to try to make it go away and put it in a closet. You actually are supporting the strength and vitality back, and that's where the healing will come in, because the more you patch a tire that's leaky, the more risky it's going to be to blow out, and you're not patching the tire. So I really commend you for that. And I want to say again, thank you for joining us on this show, Carla. It's
Thank you for having me.
A wonderful conversation. I want to get in really quickly at Nutrition World. We have what we never had before. It's called a dog health fair. I have a lady there who's the most passionate human I've ever seen on dog health. She actually had a dog that had stage 4 cancer, and using natural means helped the dog completely recover and still doing well today. It's going to be on June 29th at Saturday at 10 to 2. It's going to be a health fair. We got vendors. We have all kind of interesting things. We have a holistic vet. We're going to have question and answer. It's amazing. And again, the holisticnavigator.com. I will be interviewing Dr. Resnick, who we spoke to earlier, about female hormones and health. He's a functional medicine practitioner of the highest level. So excited about the future of everything, because people like you and I, Carla, it's not an easy journey to be an educator.
No.
Because there's not sometimes a lot of roadblocks.
Yeah.
But it's the only path I have found that enlightens my whole heart in life.
I tell people all the time, it's kind of like being a missionary. You might not want to go to Africa, but if you have something that you believe in and you know it helps people, you kind of can't keep quiet about it. And I'm just so passionate about it. It's not been an easy journey, but I know that it's what is going to help people to feel
Bingo.
better, and I can't be quiet.
Bingo. Well, I can't either. Well, that does it for this week's edition of Vital Health Radio, presented by CHI Memorial 98.1 The Lake. It is a production from the Whitfield Media Group and website by Avalon. Thank you for listening. We'll be back here again next Sunday morning, 9 a.m. for a radio show that's all about your healthy living. For Dr. Christopher Greene, I'm Ed Jones with Nutrition World. Have a healthy and safe day.
Thank you for listening to another edition of Vital Health Radio, presented by CHI Memorial on 98.1 The Lake with Ed Jones and Dr. Christopher Greene. Vital Health Radio, presented by CHI Memorial on 98.1 The Lake, is a production of Whitfield Media Group.